Good afternoon and welcome to United TV. This is our Bariatric Friday. We have an important and insightful topic to discuss that is crucial for anyone who's going through the bariatric journey. We are going to discuss the role and significance of bariatric support group. Bariatric surgery is not just a physical transformation, but it's an emotional and psychological journey as well. Because of that, support group plays an extremely important role in the process. We have Dr. Gail Wynn, who's a bariatric surgeon who was with me several times in the past, and support group actually on a monthly basis, she runs those Zoom support groups as well. And she's joining me today. Dr. Wynn, how are you doing?
Good, thanks, Kemal. How are you?
Good, good. Thank you again. So we want to discuss why patient needs to join the support group. What are the benefits? What they're expecting from the support groups. Sorry, I just hit my camera by mistake. So we just want to actually better understand what are the benefits, and if we can just start introducing what our support group does, and why do you tell your patients to join the support group?
Sure. So our support group is basically the only physician-run support group in the state. Support groups could be run by different people. Sometimes it's run by dietitians. Sometimes it's run by patients. We also have like a Facebook support group. But in our case, our Zoom support group, which used to be live prior to COVID, is run by me or one of us physicians. The main reason we have the support group is because, we operate on your stomach, not on your brain. And so there's a lot of things that kind of play into trying to become successful long term. And it's also important to remember that, it didn't take a year, a month, a day to become overweight. It took years and years and years. And so there's a lot of learned behaviors that we have. And then when we do the surgery, we want you to be successful. So then there's a lot of unlearning that we have to do and then new learning. So what's the best way to do that? The best way to do that is to give you information, but then also to hear from other people how they're coping with things, how they're adjusting to things, because they're living it every day, right? And so in a support group, you could do this and exchange ideas, exchange thoughts, discuss how you overcome difficult problems, how to overcome simple problems. And then everyone is there for each other to make sure that you're successful.
So now we have two different setups for the support group. One actually is the Zoom meetings, which now we have on every Tuesday at 5 p.m.
Yes,
So
first Tuesday of the month.
Yeah, first Tuesday of the month, and then you are running those, and then you sometimes bring other physicians, not from the bariatric side, but from like plastic surgeon was there last time.
Yeah. We had a plastic surgeon in May. Another time we had a psychologist to kind of talk about how to overcome behavioral issues to become more successful long term.
So the setting in terms of privacy and all that, in a Zoom meeting, how do we actually make the patients comfortable who are participating, whether or not they want to use their real name, how they're getting this, invitation, and what's the participation from your side? Like, do you see a lot of people actually coming out and telling you what they're going through? What's that setup?
So number one is, what is said in support group stays in support group. That's our number one rule. So unless it's something that's generic where you could share it with other people, we really want it to be private, what other people share with you. So in order to do that, you could be anonymous. You don't have to turn your camera on. You could put your nickname on when you register. And the main reason why is we want you to be comfortable. We want you to be able to feel free to share your thoughts, share your ideas, share your fears, share your gratitude. And the best way to do that is by making you comfortable. Okay. And so if comfortable, it means don't turn on your camera, then don't turn on your camera. Okay. We could hear you. If comfortable means don't put your real name on there because you don't know if someone that you know is also on that support group, then that's fine also. So the main thing is making people feel comfortable so that they can share.
So in terms of the long term, well, actually, before I go to that, I want to also make sure that our patients and who are actually watching and who may become part of our program, we have a Facebook support group as well. That actually is a little bit different than the support group Dr. Wynn is running. That's between our patients. We do approve the patients when they want to be part of that. It's a private group. And we do monitor this to make sure that patients are following the guidelines and they're not promoting anything that's something that we wouldn't want to see. So it's just sharing their experiences, sharing their challenges, successful outcomes, and asking each other different recipes and this and that. And I see actually I get notifications because of the support group, and I see a lot of patients posting their before and after pictures, just like the last one that I see, one of our patients who lost 180 pounds in 1 year. So, and it's not like it's an exception in this case. We have several patients who are losing more than 100 pounds on a regular basis throughout the program. Now, you said something very important. You said it takes a long time to get to the level of that morbid obesity, that one of the reasons that support group is needed, because it built up for so many years with the habits and with how our body is processing things. Now, for the long-term success of the bariatric surgery, what's the support group's role in that? How do you see that?
So, we always say to err is human, right? And we are all human. So we have our good days, we have our bad days. And the support group is important because it helps us share ideas with other people that are going through the same thing. And so when you have your good days, you get a lot of support and encouragement. When you have your bad days, you have people that encourage you and lift you up, that are there to kind of give you ideas on how to overcome these obstacles, overcome maybe bad thoughts, overcome, when you've kind of fallen and you need help getting back up. So, life happens, tragedies happen, stress happens, kids happen. There's so many different things that play into reasons why we eat poorly or fall back into bad habits. And support group is there to kind of help us maneuver through those stresses, through those things that kind of pull us back down to help us get ideas of how to overcome and kind of push ourselves back up.
Mhm. Now, as I was listening to you, I see one of the new posts from a couple weeks ago, maybe, person post, and I'm of course not going to mention their names. Good afternoon. Has anyone had the bypass surgery at the outpatient procedure, as an outpatient procedure at the surgery center? So, and then I look at the comments, and we didn't respond to that from the administration standpoint. And I see our patients responding. One says, yes, I did it 3 years ago. Dr. Peters did a wonderful job. The other one says, I had mine last month with Dr. Erkan, did not take any pain medication. And the other one says, had mine a year ago. Nurses were very attentive and made sure I was walking and drinking water. I mean, it's amazing. Like
Yeah.
we're not telling these people to do this. They want to do this. So that's kind of like there's a really strong bond. And that's because I guess they know what they're going through and they want to be able to support, not only support themselves, but support each other so that other people can actually benefit from their experience. So from that point, I also see this really important for our patients. Now, what are the most common questions do you get in the support groups?
So, it's interesting that you just brought up that topic, because there's a lot of people that have not had surgery yet that come to support group, and you could hear all the different fears that they have. And so the best thing is hearing it from a patient that just had surgery a month ago, 2 months ago, 3 years ago, to tell you, oh yeah, I had no pain. Oh yeah, I felt great. You know, I was surprised at how good I felt afterwards. It wasn't as hard as I thought it would be, or even like the diet, the pre-op diet that we put everyone on to shrink their liver. Once they kind of hear it from other people, like, yeah, it's not that hard. Once you get through the first couple days, it feels great. So a lot of like the most common questions are the people that are about to have surgery that are scared and concerned about, am I going to have a lot of pain? How hard is this going to be in the first, few days? So that's really the most common questions. Later on, it becomes, I've had surgery, several years ago, and I'm trying to get back on track. How do I do that? What information? How did you guys overcome? So those are really the most common questions that are asked in support group.
So in terms of, and I don't know if I mentioned this to you, well, this week, I think we missed you at the Wednesday meeting. Next week, we are doing a Zoom meeting that's going to be actually broadcast with one of our patients who was willing to share her story. And then we want to pre-record it just so that she's more comfortable. But I see how when they share their before and after picture, how proud they are. Like it's just like in some cases, like I can't even recognize the person after the surgery. They look so different, healthier, but also one of the things that I see is it's not about just the surgery, because we know that surgery is a very powerful tool, but it's not a magic. And then I see some of those very successful patients doing like activities, increase their activities, increase their workout, making sure they're following the diet that's given to them, new, adjustments. From those success stories, what actually surprises you the most with these stories that you hear from the patients?
Well, it's really like kind of like a rebirth if you think about it. Because what happens is once you lose the weight quick enough where you could kind of get your life back, you kind of reassess like what's important to me? Where do I want to be? What are my goals? How do I want to feel? And they kind of have like a rebirth of like they're no longer the same person. They're a different person. They're super motivated. And I had a lady who I operated on years ago. She's now in her 60s. And she came to me and she said, I just want to let you know, I run now. And she goes, if anyone ever told me I would run at the age of 63, I would tell you, no way. There's no way in heck I would ever be a runner. And she's like, and now I'm a runner. She's like, before I had surgery, she's like, I never even did a walk. Like I didn't exercise. I didn't like it. I didn't like the way it felt. And so it's kind of funny that this lady now in her, 60th year of life has kind of refound herself, and she's a runner. She's super healthy. She feels great about herself. And so those are the kinds of stories that I like to share with people, because that's like 80% of the time. People having, a new life, a new, feeling, something even as simple as I can bend down and cut my toenails, or I could ride a roller coaster. Another thing that people mention in support group is they got on the plane and didn't have to ask for the seatbelt extension, So it's like the non-scale victories that really kind of help you get motivated and then keep you going because you're so happy that your life has changed. So,
Yeah. So like I'm reading one of the other recent comments. This patient says, I still struggle in my mind to see the change in myself. In my mind, I'm still the heavy girl on the left. So like she still believes that she's like that psychological impact is so strong. And I see person is like 1/3 of where they were on the picture. And this is kind of like really important for people to understand. I'm still that heavy person on the left in her mind. So that's why I think the support group is probably helpful for them to really understand and hear from others to know that they're also going through the same issues. So now I know you brought the plastic surgeons a couple of times to your support group for the CHRIAS. Now that's one of the, I guess, also another common questions, because there's one, after all those great weight loss, one issue that they may see is the access skin. How do you actually address that in this support group? What do you tell them?
So one is we did by way record that plastic surgeon support group so that if people wanted to see it, they can. But plastic surgery is one of those things where people feel the need to feel better about themselves. Not everyone needs plastic surgery, and actually, in fact, only 20% of people actually end up pursuing plastic surgery. But the nice thing about support group is it's a good way to hear about how you feel about yourself, how to go about getting plastic surgery approved, what are the things that you need to do, what is the criteria, without necessarily having to make like an office visit, right? So then you could actually realize like, oh, do I have these issues? Am I going to be a candidate for it? The plastic surgeon showed us like really amazing pictures of how you go from one to, having all this excess skin to being, super svelte, I should say. It's almost like a work of art. And I think seeing those pictures and seeing the reasons why things are done certain ways and what could be done is also very inspiring too for our patients.
Now, in terms of educational, like the educational aspects of this, are you providing any resources for them in the support groups?
So we haven't done necessarily provided resources. What we do is we share ideas, and patients will give like real life resources.
Mhm.
In that, a patient will say, well, has anyone tried a good protein drink, or how do I get my protein in? And everyone has a different idea or tried a different product, and we'll share what products they have and talk about that in support group, which helps propagate being compliant with your protein, being compliant with your vitamins, online tracking of your nutrition, different things like that that help people kind of just have tools to be more successful.
See. In terms of like building relationships with others, what do you see among those patients who are participating?
So I think what the support group does is it builds a strong community of people that are willing to help each other. At times, on and off, we've had patients that had surgery like years ago that have been super successful, and they come to support group just to inspire others. They really just kind of have such a positive experience that they're so excited to share it and help others be as successful as they are. Another thing that happens in support group is it's almost like a buddy system, right? So you have people that are feeling like, I don't have a family that supports me, or I don't have, a friend that supports me. But when I come to support group, I have a buddy there. I have people there that are there that kind of understand and help me through.
And that's important because again, unfortunately, in some cases, we may not get the most support from our family members. They may not have the same education level, same struggle that we are going through. So in those cases, having someone where you can trust and then knowing that they have no horse in the race. So that's probably just making it easier. And again, there's this really psychological part that's very important. Dr. Wynn, from the accountability and motivation standpoint, and this is kind of related to the um, person that they get, like a bariatric buddy, we can call them. So in terms of accountability, how do you see the role of support group in that? Uh, are the patients more accountable because of the support group?
I think the more successful patients tend to go to support group, tend to do their follow-up appointments, and they feel like they are more accountable, right? Because they do all these things. And when they're held accountable, then they tend to be more successful.
Mhm.
For instance, like I have a patient that comes to support group all the time. And then she also comes to her follow-up visits like every 3 months, even though she's had surgery years ago. And
Mhm.
the reason why is because she feels that being held accountable is what helps her be successful.
Right. And that's also important for other things that we do in life. Now, when I do this session with Dr. Erkan, one of the things that we have tried to emphasize, and I do that a little bit more than maybe he does, is like people who are not going through the bariatric process are doing a lot of things that patients who are going through the bariatric process, or they either had their surgery or they're going to have their surgery. Now, you are also one of those examples. You are extremely active, and I know you are eating healthy. How much effort you put into your wellness so that patients can kind of relate, because this is not, something that only patients who are going to have bariatric surgery needs to do.
Yeah, so it's funny that you say that because that's probably why I love this job because it's all about preaching wellness, right? And wellness is a lifestyle. And it's not something that you do just to lose weight. It's something that you do for longevity. It's something that you do to feel good every day when you wake up and to feel like you can wake up and feel good versus just, laying in bed all day and feeling terrible and lousy because of what you ate the day before, things like that. So I spend a lot of time reading about longevity, about wellness, about eating healthy, about exercise. And then I spend a lot of time also practicing. I eat plant-based. I preach eating plant-based to my patients. And eating wholesome for those people that don't want to be plant-based,
Mhm.
because it's really important that you kind of look at your whole lifestyle, right? It's a life change when you have weight loss surgery. And it's really, now that you're starting to feel better about yourself, it's improving your gut microbiome, it's improving your cardiovascular system, it's starting to improve your muscle mass, your bone density, all those things that are going to help you live a long, healthy life. So, um, yeah, it's basically, one of those things where, like, from the time I wake up till the time I go to sleep, I think about everything that I do in my day that's going to help me just eat better, stay active, that kind of thing.
Well, I mean, you are one of the best surgeons out there, not in Delaware, not in the United States, probably in the world, in bariatric. You have 3 kids, you have a full-time job, and I see some of sometimes I have a little bit difficulty following what you are doing. I'm like, oh my God, like she's how is she doing it? So we can always find excuses. So and I think that's important for our patients to kind of hear that. Like it's easy to say, well, it's rainy, I'm not going to walk today. Well, the raincoat will just do the job, but you just don't want to walk. Or it's cold, but if it's cold, then put gloves and put a hat, and then just you still need, because we are not saying that you need to kill yourself while you are exercising. You just need to stay active, and that is the lifestyle. So, like, if you know that you need to walk 45 minutes into, like, 25 minutes each in the morning, in the afternoon, and then trying to keep things healthier, effortless, but still require planning and effort. So, and then if you are able to do what you are doing with all the responsibility that you have, we have no excuse. So I tell people that this is what it is. So we just need to understand and then see the good examples and then follow them. So Dr. Wynn, anything you would like to add before we close? What would you like to tell the patients so that they would remember to just join the support group?
So, yeah, the support group is a place to get ideas and share ideas. And everyone is there because they've been in your shoes at one point or in another.
Mm.
And so it's there to support each other, but it's also there to develop ideas and to kind of help you through life and life's challenges. And also, if you're about to have surgery, to find out more from other people, or if you've never had surgery and you're thinking about it, to just hear from other people what their experience is, so they'll help you overcome your fears, your anxiety. And our goal, whether it's support group, whether it's weight loss surgery, whether it's just being a physician, is to help you live a long, healthy life and enjoy your life while you have it, because we're here for a limited amount of time. So maximize the opportunity, right? And the best way to do that is talking to other people and hearing their experiences.
Absolutely. And we have the platform for that. So it's a very easy one to reach to those events on CHRIAS website. Our patients can sign up for Zoom and also become a member on the Facebook group. And we also do these sessions. And then the reason we are doing it is because we know that this is part of the support. And in many cases, people know already by now that we are repeating some of our topics on a regular basis. And that's because this is so important. And it's not easy to overcome. And that's why we are here every Friday to provide these extra resources for our patients. Having a surgeon in these events, any of the clinical events that we do from United Medical side and from the CHRIAS and American Surgery side, we do it with providers, licensed providers, because this is not about promoting our program or some commercializing our program. This is about healthcare and well-being, and hopefully our patients can find these helpful. And then we are going to be back with another episode next week with Bariatric Friday. Dr. Wynn, thank you so much for joining me, and we'll see you guys soon.
Thank you, Kemal.
Bye.